Hi, I'm Ephraim Payne. I'm the development director at Beyond Toxics, and I'm here with Dr. Deke Gundersen, who is an educator and a scientist and works with us. Deke, can you please introduce yourself?
Yeah, I am a professor of environmental science at Pacific University, and I've been there for 20 years. Most of my research involves toxicology studies, particularly on aquatic organisms. And I have worked with Beyond Toxics on several things. Some things involve working with the public, providing them with information on the dangers of exposure to various herbicides and other agricultural chemicals. And I also worked with Lisa Arkins on a court case in Gold Beach where some people were exposed to herbicides that were sprayed on them by an aviation company.
So what was the problem there? You can just briefly tell us.
Yeah, so apparently there was a helicopter that was spraying an area that had been recently logged and replanted. And as they were refilling the tanks with herbicides, I think it was a mixture of 5 different herbicides. They would refill in one area and take off and fly over to the area that had been logged. And apparently their tanks had leaks. And so as they traveled from the refill area to where they were applying the herbicide, the herbicide was leaking out of the tanks and onto several homeowners that lived in the area between the 2 sites. I think approximately 20 people or somewhere in that neighborhood were exposed and suffered a variety of negative health effects, and including even injury to some of their animals, dogs and horses and things like that.
Well, that's really disturbing, and that's one of the reasons why Beyond Toxics works to eliminate aerial spray in our forests and over our communities. And it brings me to one of the main topics we want to talk about today, which is the synergistic versus additive effects of chemicals. So can you talk about that, maybe using that case as an example of the problem?
Well, the root of the problem, first of all, is that all chemicals, when a company produces a chemical, the pure chemical is tested. And, in the case of Gold Beach, not only did we have a mixture of herbicides put together, but we also had other formulations that help sort of dissolve the pesticides, help them penetrate the plants. Sometimes it can be even things like kerosene or diesel fuel. And so, you probably had a mixture of, 10, 11, maybe even 12 different ingredients. And those have never been tested. And one of the things that we know when looking at exposure to chemical mixtures is, it's sort of intuitive to think if you had chemical A and you exposed a certain number of organisms to it, and let's say 10 died, and then you had chemical B and you exposed, a certain number of organisms to that, and 10 died, and then if you put 2 of them together, you might expect 20 to die. That's kind of what we call an additive effect. But a lot of times we can see a synergistic effect, which is greater than an additive response. So in the example that I gave, instead of 20 organisms dying through the chemical mixture, maybe 80 of them die out of 100 or something like that. So it's a very exaggerated response to an exposure of a mixture of chemicals.
So that is definitely really disturbing. Can you talk about that in a relationship to the idea that we've had for so long that the dose makes the poison, i.e. anything is toxic if you take too much of it. Even drinking an extreme amount of water can be harmful. But this seems that it changes things.
Well, what we're finding, I think part of it has to do, a lot of these herbicides we're finding out are what we call, they affect the hormones in your body. We call that your endocrine system. And hormones kind of operate in our body in a really unique way. And so when you do studies, like a dose response study, and you're looking for certain effects, a lot of times it's very complicated with hormones. You have to really test a really broad spectrum of doses or concentrations, because you can be fooled at kind of a middle concentration. You can get these sort of U-shaped dose response curves. They're usually either linear or sigmoid shaped. And you might even be looking at it where the curve is actually coming down, and your assumption would be, oh, well, actually the toxicity is decreasing with an increasing dose, and therefore you could make your conclusions about that chemical could be completely wrong. So we're noticing, particularly with these endocrine disrupting chemicals, that they don't behave like some of the chemicals that we looked at in the past. They don't have a typical dose response. They can have these inverted dose response curves, which then means we can incorrectly be evaluating the risk of them.
So that sounds to me as a layman like there are incredibly complex relationships with these chemicals going on, and they're maybe not as predictable as someone like me would hope. So is the government, the EPA, and our private companies who are either making these chemicals or mixing these chemicals together in the field and with additive agents like the diesel fuel you mentioned, are they testing those so that we know what's going to go on if someone does get accidentally sprayed, or if residual pesticides, wash into the water stream and get into people's systems through drinking water?
Yeah, I mean, we know almost nothing about what these mixtures can do to wildlife and or humans. Again, all is that the companies are required to do. Let's say you have, Monsanto comes up with glyphosate, which is in Roundup. They just test the pure glyphosate. They don't test what they call the glyphosate plus, they call them inert ingredients. And then they can be a variety of things. And oftentimes we find out that the Roundup, the mixture, is actually more toxic than the pure glyphosate itself, let alone take the Roundup and mix it with other herbicides. So yeah, there are not any requirements to look at the complex chemical mixtures that are actually typically used, and people can be exposed to these mixtures along again with like wildlife and other organisms. Yeah.
Okay. Wow. That again, super disturbing. So can we talk about that in response to, or in the context of vulnerable populations? Because we know that I know as a parent that my child, when she was young, she was more vulnerable to chemical exposure than I am. And as we're seeing with COVID-19, some of us in our population, in our community, are more vulnerable than others.
Yeah, absolutely. Again, particularly when we look at a lot of these chemicals, which kind of, again, disrupt our hormones, probably one of the most critical stages where hormone levels in your body are important is when you're a small child developing into an adult. That development into an adult involves hormones, and it involves those hormone levels to be incredibly precise to help you become an adult male or an adult female. In addition to that, if you're pregnant and exposed to these chemicals, a lot of them, again, can be passed on to the fetus. And again, that's obviously a really important developmental stage, and a lot of that development, again, is influenced by hormones. And the thing to remember about our hormones is they're super effective at incredibly, incredibly low concentrations. They do a really good job. So it really doesn't take much to disrupt that whole system and cause a lot of problems, particularly for children who are, in the middle of development into adults. In addition to that, children usually don't have the same capacity to metabolize some of these chemicals that we're exposed to. So they tend to stay in their bodies for longer periods of time than they might, again, with an adult.
Okay. And so we are an environmental justice organization, and it appears that, along with our children or, say, elderly folks, there are populations who are more at risk from chemical exposure than others. Typically field workers, farm workers, forestry workers, and the working class communities of color. So can you talk about this in an EJ perspective about multiple types of toxic exposure and how that doesn't hit us all equally?
Yeah, I mean, first of all, a lot of us are able to select where we want to live, and we can choose if we want to live in nice open spaces and not next to factories and other polluting industries where people of color, a lot of times they're on a shoestring budget and they're just trying to, make ends meet. And so they live in the dirtiest, most polluted, toxic areas. In addition to that, they're more susceptible to chemical exposure, again, because they don't have the luxury of eating really healthy diets like we can. They can't buy a bunch of organic food and things like that. So a lot of them have pre-existing health conditions like diabetes. And again, some of these chemical exposures can exacerbate those conditions. A lot of times with migrant farm workers, they're not properly trained on how to use these chemicals. They don't have the proper safety equipment, and so they're also at risk of harm just due to the lack of training. So yeah, definitely, it's a greater problem for minority groups that really can't escape these things.
Um, that's really something that we need to work on, I believe, and that's what Beyond Toxic is focused on. And right now, everyone's focus is turned on to public health because of the current pandemic with the coronavirus. And you relate the fact that people are getting uneven exposure to chemicals and getting, sick from these chemicals or having harmful health effects, how that will affect them when you have something like a coronavirus, something that's hitting the entire population.
Well, any kind of chemical exposure is actually stressful to an organism. You may not realize it, but it actually elicits a stress response. And if you're chronically exposed to these chemicals, you produce a hormone that's called cortisol that actually suppresses your immune system. And of course, if your immune system's suppressed, then you're going to be more susceptible to pathogens like COVID-19, for example. So exposure can have severe effects on a person's, on the normal functioning of a person's immune system.
So what you're saying is people in environmental justice communities are more likely to be hit harder by a pandemic because their living conditions or their working conditions have put them at a disadvantage to, say, the general population.
Absolutely, in every way, shape, and form, too. It's not just chemical exposure, but it's their diet, the level of stress that they're under, and so on and so forth. So they're at a huge disadvantage in comparison to me, for example.
That's frustrating, and that's definitely a motivator to take action. Unfortunately, we're seeing at the national level the wrong kind of action being taken. What's your response to the suppression of our environmental regulations and of the EPA right now as a response to the coronavirus? Is that as crazy as it sounds?
Every day that I hear something coming from our federal government, I just can't believe what I'm hearing. And what we're going to find out, which we found out with the coronavirus, for years people are saying, hey, we're going to eventually be hit by a pandemic. We need to be prepared for this. People kept warning. Those people, by the way, were scientists. And we're saying the same thing about even things like pesticides, the pesticide exposure, that at some point we're going to pay for this. We need to back off. We need to change our practices. I've seen firsthand for myself. I actually do some consulting for an agricultural firm, and they do all organic. Production is off the charts, flavor is off the charts, nutrition's off the charts, and they're not using harmful pesticides, herbicides, chemical fertilizers, or anything like that. So I've seen it in practice, and it works. And again, scientists have been warning about this, and sooner or later this is going to catch up to us as well, unless we put on more stringent restrictions on these chemical companies and the ability to use these chemicals kind of haphazardly.
Yeah. Clearly behavior changes are needed and that takes better regulation and better enforcement. On a happy note, we produced a statement just a while ago supporting our own Governor Brown here in Oregon, who has reaffirmed our state's commitment to protecting the public and protecting our environment. So there's a ray of hope there that, even if things on the federal level are being relaxed, here in our state, what the power that the state has to protect us won't be diminished, though obviously it's not as much as what the federal government has. So I really appreciate you taking the time with us. Is there anything else on this topic that you would like to add or that you'd like people to know?
Like I say, I hope, on some of these similar issues, like pesticide use and whatnot, that I guess the one thing maybe we can learn from this is maybe we should start listening to the scientists on this, and that the warnings are there, and scientists have been asking to for people to change their practices and behaviors. And so I hope we can learn a little bit of that from what we're seeing with coronavirus and what's going on currently.
Thank you. It's really inspiring. I wish you and your family and all your loved ones the best of health. And I hope to see you in person again after this is all over.
Yeah, and you too. Same thing with you and your family. I appreciate you having me. Thank you.
Thank you. And thank you everyone who supports Beyond Toxics in what we do.